I'm Casey Ingen. I'm here from Brookings, South Dakota, and I run the Canine Country Club dog boarding. Both of my kids were overdue. Isaac was 5 days and Audrey was 12. She was a little bit more intense because they had to do some inducing with Pitocin, but it was still natural as far as no pain meds or anything like that. And it was, I don't know how to compare to anybody else's, but for me it was intense, but it was easier than I was expecting. I actually kind of looked forward to having Isaac because I knew that the nurses here were outstanding, and just the way that they made you feel like a person. It was exciting to know that you're going to be cared for. I was kind of brought up in a family where your body just knows what to do, so it'll do it without needing any instruction or anything like that. So that was my initial plan, was, to just go as natural as I can to let my body do what it needs to do and knows how to do. And then if I needed any help along the way, I know that the doctors and the nurses would be there to kind of say, I think we should, maybe take a different route or do something, but they didn't, and it was really kind of a fast birth and an easy birth, so the second time around. The nurses were great. When we came in, I really wanted a natural birth and really kind of to stick to my plan, and they were very supportive of that. They encouraged me when things got tough. They really took care of Mark and let him know the things that he could do to support me when things were getting tough, and I really felt like they helped me stick to my plan the entire time, and they were great. I really enjoyed them being there. They were really great about keeping me breathing. They gave me different instructions as to keep moving. They gave me the peanut ball when I wanted to rest and lay down to keep my contractions and stuff going. And then they instructed Mark, you can give her back massages, you can help her breathe, So they're really good at supporting both him and I during all of this. The nurses were amazing. I always tell people that in the most vulnerable time where you're just kind of exposed and you're vulnerable, they give you so much care and they treat you like a person, and they show you so much dignity and respect, and it's just incredible the job that they do, because it's not an easy job, but they're calm and they're supportive, and they teach you, or they treat you so well. So, well, one is I just think I have the availability to do it. I don't want to mix a bottle or anything like that. And they always say that breast is best. It offers the immunity and the antibodies, and it's a little easier to travel. I mean, you don't have to pack anything else. But I also really like the bonding experience that I get to share with them. It's kind of like a relationship that, it's just you and the baby, and you have that special bond and that special time. And the baby cafe was amazing. With Audria, I had no idea what I was doing. She had a bad latch. We had thrush probably 9-10 times, and it was miserable. The breastfeeding journey was not magical for me. But I started coming to the baby cafe because I was gonna quit, and I met with the nurses there and the support staff there, and every week I came back because they kept me going. They gave me new things to try. They helped improve her latch, and we ended up breastfeeding for about 20 months. We ended up breastfeeding when I wanted to quit after the second month. And then Isaac, I knew that I was going to have some problems with too, because I'm just not a natural with the breastfeeding. So we've been going back there, and the support system, I think, helps you. You get to talk to people, you get to talk to moms, get ideas, and what works and what doesn't, and the staff is really good. So he's 17 pounds as a 2-month-old, and I think a lot of that is because they've helped me with his latch and all that. So I can't say enough good things about them. I just thought that she would know when she would be ready to be done, and if she kept asking for it and my body was still producing, then that would be something that she knows, she wants to keep doing. And also, the sustained immunity, and they give them the antibodies, and your body knows what they need. And she's been so incredibly healthy, and I attribute a lot of that to the length of time that we breastfed. because she's had a cold once in her 2 years of life, and so she's been really healthy, and I think a lot of that is breastfeeding. I would have kept doing it longer had she not weaned herself, so. I really think that you're not going to find better care anywhere else. The nurses here are amazing. They're so supportive, they're so knowledgeable, and they're so caring, and you won't find that, I don't think you'll find that anywhere else. The doctors are knowledgeable, they're helpful, they're not pushy, and they really let you stick to the plan that you want to stick to. So I would tell them do it, because there's a great amount of people here.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.